Dr. Pomerantz, I noticed that you also treat snoring and sleep apnea. Is this unusual for a dentist?
I'd venture to say that less than 1% of dentists treat sleep apnea. It's certainly not mainstream.
What is the difference between snoring and sleep apnea?
Snoring is the partial closing of the airway while we sleep. As the air pushes up and down through the mouth and nose, the muscles vibrate and cause a snoring sensation or snoring sound. Sleep apnea is the complete closing of the airway and preventing the patient from breathing. Sleep apnea is the most underdiagnosed medical condition in the United States today. Irritability, snoring, excessive fatigue are all possible signs of sleep apnea.
Is sleep apnea dangerous?
Sleep apnea is very dangerous. Very often patients don't even know they have this sleep apnea. Sleep apnea has been linked to heart disease, stroke, gastric reflux, cardiac disease, and many other issues.
As a dentist, what can you do to help people with sleep apnea and snoring?
Well, in our office we fabricate an oral orthotic. And the premise to the oral orthotic is it prevents the jaw from falling backwards while we sleep. And when the jaw falls backwards when we sleep, it causes a collapse of the musculature and prevents airflow. So the oral appliance has two pieces to it and prevents the closure of the airway.
Now, is the appliance covered by insurance?
Most medical insurances do cover the appliance.
Are there other treatments out there for sleep apnea, and how do they compare with the appliance?
There are many surgical techniques that are used to try to treat sleep apnea, the most common of which, in its simplest form, is basically removing tissues from the airway to keep the airway open. The more common treatment is the CPAP machine. And the CPAP machine is a machine that's used to keep positive air pressure in the nose and in the mouth to keep the airway open. The problem with the CPAP machine is it's bulky, it's loud, it prevents patients from being able to roll over when they sleep, and the compliance rate with the CPAP is not very good.
My sleep apnea was very bad. Almost fell asleep behind the wheel numerous times. Tried CPAP, didn't work. Tried surgeries, didn't work. Then I found Dr. Pomerantz. It worked.
Ever since Dr. Pomerantz made my sleep apnea appliance, I wake up in the morning a lot more refreshed, have a lot more energy during the day. It's just made my life a whole lot better. I'm glad I have it.
So there you have it, a look at 21st century dentistry. You have to admit, it's certainly come a long way in the last 15 years. For Spotlight TV News, I'm Tony Segreto.